by March 31st, 2022, including the deployment of nursing students and other healthcare providers in training. We continue to learn more about Omicron. For instance, the length of stay in intensive care units is decreasing slightly, with the median stay currently 7 compared to 20 days during the peak of Delta. At this time, approximately 600 ICU beds remain available today, with the ability to add nearly 500 additional beds if required. Our government will continue to closely monitor prolonged hospitalizations and ICU admissions as we respond to Omicron, and will not hesitate to take further action if needed. Finally, I wanted to note that tomorrow the province will update its reporting to distinguish between patients hospitalized due to COVID-19 from those admitted for other reasons with COVID-19. Today, the data tells us that 54% of individuals were admitted to hospital for COVID-19, and 46% were admitted for other reasons, but have tested positive for COVID-19. In our ICUs, 83% of individuals were admitted for COVID-19, and 17% were admitted for other reasons, but have tested positive for COVID-19. While this doesn't change the serious situation in Ontario's hospitals, we feel it is important to share this data to provide additional context and support our continued response to the pandemic. Our government is committed to supporting our healthcare system and our amazing frontline healthcare workers so they can continue to provide care for our most vulnerable patients during this very challenging time. However, the best defense against Omicron and to stay out of the hospital from COVID-19 is to get vaccinated. So once again, I encourage everyone aged 5 years and older to get your first and second dose as soon as possible. And for those eligible for your booster, please book an appointment as soon as you can. Thank you.
Go to the phone lines for questions. Just a reminder, one question, one follow-up. Over to the first question, please.
From Holly Mackenzie Suter at the Canadian Press. Please go ahead.
Hi, Holly.
About the decision we learned last night about reopening schools next Monday. Can you elaborate and give specifics on what health indicators that have improved over the last week to support that decision to reopen schools when it seems like a lot of the pressures on the health system, like hospitalizations, have actually gone up since the remote learning was announced?
Well, we know that it is really important for students to be in school for both their physical health, because all of the protocols, the public health measures that are so important for all of us are being followed in our schools, but also for their mental health. It's really, really important. And we've seen the numbers of mental health needs rising rapidly. We know that it helps students to be in school for their mental and physical health. And that is why our government, and particularly Minister Elliott, our Minister of Education, have done everything that we can to make our schools safe for students. We have introduced special clinics, as you know, for teachers to be able to get their vaccinations. We've sent millions of masks, over 9 million masks to staff, and 3-ply masks for students as well. We've also ordered over 3,000 more HEPA filter units to make sure that we can have the appropriate ventilation and clean air for children. So we are taking every step that we can possibly take to make sure that our schools are safe for our children to return to.
Follow-up?
Okay, thanks. Yeah, I didn't really hear an answer about the health indicators question, but I also have a question about testing capacity, because at the moment, it seems like PCR tests are being deployed basically at the level they were during wave 3, and not quite at capacity yet. So I'm wondering why not make those tests available to students and staff and daycare students and workers in those settings as well, just to help people feel more confident and have a better sense of the level of safety in schools when people return?
Well, there will be PCR tests available in schools when they return for students or staff who are symptomatic while in the school, so that they may need to leave to go home. But the PCR tests will be available for them within the schools if they are symptomatic. But we are also working with the federal government to get more of the rapid tests in. That is a priority for us as we do receive them. We received over 3.5 million of the rapid tests yesterday. Many of them will be going to schools for students to be able to do those tests, but perhaps Matt would have some further comments on that.
Great, thank you, Minister. I would just add that we have seen with the testing guidance changes just in the last few days a reduction in demand on the PCR network. That was by design, and as we look at now being able to bring schools back online, we can repurpose that volume and capacity to support the opening of schools.
Next question.
From Matthew Bingley at the Global News. Please go ahead.
Hi, Minister. I just want to follow up on Holly's question. What has changed in the past 2 weeks that makes schools safer on Monday, but unsafe last week? Because parents are looking for concrete measures taken and also to directly look at those health indicators and be reassured. Is it simply that mental health is a consideration, or is there something else that specifically changed?
No, I would say that the extra measures that have been taken by the Ministry of Education are doing everything we can to make schools safer for students. And I know Minister Lecce will have further comments about that. But one thing that we did need was extra time in order to be able to have the teachers be able to come in for their second dose, in some cases, well, booster doses as well. And that is one of the really important measures that we needed. We also needed to get the rapid tests in from the federal government. They're just starting to come in now. And we've also received millions more in masks, the N95 unfitted masks that are going into the schools for teachers, and the 3-ply masks for students as well. So some of it, we just needed a bit more time in order to get all of those provisions in place and those measures in place, so that the parents' concerns can be relieved somewhat.
Follow up.
And yeah, on reporting cases, why are you not going back to reporting them on a school basis to give parents a more reassuring look at what's actually going on in schools? And to expand on that, some of your opponents are saying that that you should be showing on a school by school basis where these HEPA filters exactly are and how many schools are getting these masks by the numbers, so they could again be reassured. Why is it an ability to do that on a vaccination or a hospitalization level, but not break it down on the education level?
Well, as I said before, Minister Lecce is going to be providing further details on that later on this week. But I would say that one is that every school has been inspected to make sure that they have the necessary precautions in place with the HEPA filters, and that they're doing everything they can with respect to ventilation. We know that they are receiving the rapid tests and the masks. But there's also the fact that we know right now that Omicron is widespread in the community. There will be some people that will be staying home that haven't received the test, but they have the symptoms. And so it will be rather difficult to report on a daily basis in schools as to the exact number of students that have Omicron. But we, as I said before, we have inspected all of the schools to make sure that they have all of the safety standards that we require in place.
Next question.
From Cynthia Mulligan at City News. Please go ahead.
Hi, Cynthia.
Hi, Minister. To follow up a little bit further on that question, I mean, under the guidelines, it says that schools will not be notifying if there are outbreaks or cases in the class. In other words, parents will have no idea what's going on in their school. And there's no way to track this. So in other words, are you just sort of saying, let her rip and you're on your own?
No, not at all. And as I said, Minister Lecce will be speaking further on this, but I think that Matt may have some further comments on this particular item as well.
Sure. Thank you, Minister. I would just say, going back to the discussion around the PCR testing, by bringing that, opening that back up for our kids and for our teachers who are in school and symptomatic, that will allow us to start doing that reporting again and give us that through the PCR. One of the things I think you might recall, Cynthia, is that if we do the reporting through, or pardon me, the testing through an assessment center, we can't assign it out to a school. So we're working through that with Ministry of Education right now on can we do the model that was used prior to Christmas, where the swab kits would be in the school and we can test and assign back to the school. So we're looking at that right now as a further measure to try to support the reopening of the schools.
Follow up.
Hey, I'm sure my colleagues next in line will want to ask more about this. My other question is, what is the impact? What is the impact that you are expecting on hospitals once schools reopen? Have you done modeling, and do you anticipate another surge in cases?
I'm going to ask Matt for his comment.
For sure. For sure. Thank you, Minister. So I think that, so this is really more for Dr. Moore, but I would say that the data suggests that being back in school does not drive up the cases for our kids. And what we need to monitor really is absenteeism for our teachers and for the kids coming back to school. So not projecting that this will drive up new cases necessarily, but certainly the risk from community spread that will have absenteeism challenges in the schools.
Next question.
From Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Rob.
Hello, everyone. Just on the hospital situation, can you provide more details, Minister? The sound on the call actually started late after you were already speaking, so I'm not sure what we missed. But aside from internationally trained nurses going into hospitals and nursing homes, you were mentioning that nursing students and other healthcare professionals in training will be dispatched to hospitals. Can you give some more detail on that? Who are these people? In what kind of numbers will be deployed? And how is it all going to work?
The nursing students, medical students as well. Matt, could you expand the list of the other students that would be considered for work in our hospitals during this time frame?
For sure. So on the student front, as the minister has already mentioned, we would have the nursing students. We'd also look for allied health students and medical students as well. We put them into various types of programs. The most common program is called an extern program. So this is where a student would come in. Usually we try to do it in a group of at least 4. We then have a preceptor at the hospital who would receive these folks and supervise them in their care through the system. And so those are the kinds of students that we're talking about in the overall program that we would use. And that's what's supporting the numbers that Minister Elliott spoke about off the top.
Follow up.
Okay, thanks. I'd like to get some more numbers on that and how it's going to work, in addition to asking where are we in terms of case levels and peaking and whatnot in this wave?
Well, as a result of Directive 2 going out, we know that that's going to result in 1,200 to 1,500 more beds, but most importantly, health human resources that go along with that. And so while it's really regrettable that we have to postpone some of these other surgeries for a period of time, we do need those resources to battle the number of people that are coming in with Omicron. Fortunately, the hospitalization times are generally shorter for Omicron than for Delta, but it's still usually 7 days as compared to 20 days with the Delta variant. But Matt, would you like to add to that as well, please?
For sure. Thank you, Minister, and thank you for the question. I guess I think it might be helpful to separate out health human resource challenges sort of chronically and absenteeism which is sort of the acute scenario that we've got going on right now. And so, as Minister Elliott has described, there's a number of programs that sort of are addressing both, but are about bringing more people into the environment. So if I use the example of the internationally trained nurses, which the minister was announcing today, and our friends at the College of Nurses who have been absolutely fantastic to work with, they'll be doing a further announcement later today. So in that instance, there we're looking at how we are adding more nurses. And as Minister Elliott said, already 1,200 have signed up as interested in joining into the program. And this is about getting them into the program faster, into the field faster, so that they are able to start to help with the larger problem, larger challenges around our HHR. Absenteeism, while the program we've just described certainly helps with that, absenteeism is really the acute challenge that we're facing right now across not just our hospitals, our long-term care homes, and certainly throughout all different industries. And there, we're looking at very specific programs that the minister referred to with the decision on Directive 2 to pause non-emergent surgeries and non-urgent, non-emergent surgeries. That does a couple of things. While it does free up inpatient beds and ICU capacity, that's very, very important. It also allows us to redeploy the people who would be working in those clinics. We're also approaching our colleagues in independent health facilities to do the same, see if they can be redeployed to offset some of these absenteeism challenges and take some of the pressures off of our hospitals and our long-term care homes. And absenteeism right now, I would say, is really the big strain on the system. And if we think about the volunteers that Minister Elliott has referred to, if we think about our friends, our colleagues in independent health facilities, one of a model that we're looking at is, could they take over or support the vaccine efforts, or perhaps in our assessment centers or swabbing centers, and then those staff who would be part of a hospital can go back into the hospital. So you have this effect of moving folks in this absenteeism response, really trying to redeploy our health human resources in the most efficient way possible to fill in any gaps related to absenteeism. So those are the sort of two strategies. We often talk about them as one, but it's really two strategies going on.
Next question.
From Jeff Gray at the Globe and Mail. Please go ahead.
Thanks very much. The question for either of you. I mean, Dr. Moore mentioned that there was the hope or the belief that this wave would be peaking. I believe he said end of January. I've heard someone else talk about an earlier date than that. Are we seeing any indication? Is there anything that we can hang a hat on, hang some hopes on of an indicator that shows us that might be happening, that this wave will crest sometime within the envelope of what we can handle?
Well, there is an indication. The modeling that's been done and what we're actually seeing with hospitalizations and so on is that we expect that this will peak the third, fourth week of January, with the first and second week of February for ICUs. But I'll ask Matt to provide further particulars to you on that. We're following it very carefully.
Sure, thank you. And again, the overall epidemiology of the wave, I would leave to Dr. Moore to comment on. I just echo what Minister Elliott has commented on. We continue to see an increase in hospitalizations and an increase in our ICU capacity as well, or utilization, pardon me. The one thing I would say that perhaps is some good news for us at this moment is that the rate of increase on hospitalizations seems to be slowing. And the rate of positivity on our PCR network also seem to be slowing. I would say both of those, from my perspective, it's still a little bit early days to declare what that means from a trend perspective. I would leave that to Dr. Moore to declare. But we're working against the same scenario that you've heard and that Minister Elliott has described, an expectation that we would continue to see cases rise over the next week or so. Cases should then start to maximize or plateau, and then we would start to see that phenomenon happening with hospitalizations towards the end of January and ICU into February. So that continues to be our expectation of what's going to happen with this wave.
Follow up.
Thanks. And to follow up on the PCR test PCR tests in schools issue there. I'm not sure, just like a ping pong ball, trying to follow exactly what the testing rules are going to be. But if my kid gets the sniffles, the idea is I'll be able to get one of those take-home PCR test kits from the school and bring it back to the school potentially, and then get a result in a few days on whether my kid has COVID-19 or not. Would that test result then be reported? Would I get an email from the school? I mean, why wouldn't it be reported?
So
Go ahead, Matt.
it absolutely would be reported, and I'm sorry if I confused you in my answer. What has happened in the different waves is that in certain waves, we had school testing kids and teachers going to an assessment center. If it goes to an assessment center, we can't map it back to a specific school. If we do it in the way that you just described, then we can map to the school, which I think is, and again, I don't want to get ahead of Minister Lecce and his announcements later this week, but those are the kinds of, that's what we were doing before Christmas. I'll leave it to Minister Lecce or others to comment on what the approach is going to be for coming back to school.
Last question.
From Chris Glover at CBC News. Please go ahead.
Oh, hey there. I just wanted to hop back to the internationally educated nurses. Can we get a timeline in terms of when these nurses will actually be on the job? And I think I heard that more than 1,200 applicants have expressed interest in participating in this program. So I guess practically speaking, what kind of an impact are you expecting this program to have? Because at UHN hospitals alone today, they have roughly 1,000 frontline staff off sick.
Thanks for your question, Chris. Please go ahead, Matt.
Sure. Thank you, Minister. Thank you for the question, and it's great. It's a great question to sort of go back to what I was trying to separate out in terms of ongoing health human resource challenges and absenteeism. So in absenteeism, the numbers, as you've just described, are very high all across our healthcare system. So there, the strategy that we're doing to improve health human resources generally certainly apply, but we had to do specific strategies, particularly as we look at Directive 2 and the freeing up of ambulatory staff and other staff in independent health facilities and so on, to try to get some scale to respond to the absenteeism problem. So absenteeism itself requires its own strategies. That said, when we come back to our nurses, adding 1,200 nurses permanently into the system who are experienced and trained is a great step forward for us. In terms of the logistics on that, that program will start today. And what happens, not to get into too many details, and I know that the college would like to speak about this as well this afternoon for the wonderful work that they've done. But just to say that starting today and through this week, there would be a matching program where we will find the first cohort of nurses. We're estimating that to be in and around 300 that would immediately start working. We've identified 50 hospitals, a little over 50 hospitals, 300 nurses, match those folks and get those nurses into the workforce immediately. And I would say as well that although, yes, we certainly have the scale problems that come to us with absenteeism, on the other hand, every nurse matters. Every person that we can get to that front line of care makes a difference. And so we're very keen to get this underway and fabulous to work with the College of Nurses to make this happen. And these folks, by the way, the idea is that when they go and they're matched with the agency, they complete whatever their requirements are for their licenses, and then they become a permanent employee of that agency. So these are folks that we want to get permanently into the workforce.
Follow up, and this is the last question.
Okay, great. Thank you for that. The other question that I have is the Ottawa Hospital is directing COVID-positive staff to return to work in some cases. I've touched base with other hospital networks in the GTA. They're also looking through a policy like this. We know Quebec took a step like this at the end of December. So what is your position on this? I'd love to hear from the health minister and from you as well, Matt. And then what happens if other hospitals adopt the same policy?
I think this is first of all, a question for Matt. I'd like Matt to go ahead on this.
Sure, of course, Minister. Thanks. It is very operational, so appropriate for me to comment on. So thank you. We have established with the support of our Chief Medical Officer of Health, a protocol for hospitals to use under what circumstances is going on with respect to absenteeism, and then how you would move up the protocol up to and including bringing back folks, employees or staff who have tested positive. I don't know the specifics of the Ottawa hospital, so I can't really speak to that, but can speak to this is a protocol that has been established for all of our hospitals on what that path would look like. There will be certain requirements and restrictions on areas that somebody would be, if someone is brought back under these conditions, there's restrictions put on them in terms of where they can work, and that would be, again, back to the hospitals, but everybody following a common standard that we established in case this kind of situation does arise.
Thanks, sorry, go ahead.
Sorry, I was just going to say we are being extremely careful with hospitals. There's some hospitals that have already indicated that they must have totally vaccinated staff working there. It's up to the hospitals to determine what their policy is in this respect. But for those hospitals that don't require that, there's still a requirement for very strict testing for anyone who is unvaccinated to be able to come in to work in the hospital for the protection of other staff, for patients, and for everyone in the hospitals, visitors included.
Thanks, everyone.
Thank you.